we jump in, let's just state something up front, something medical science is really clear on now.
Mm-hmm.
Obesity. It's a chronic medical condition.
Mm-hmm.
Seriously complex. We're talking genetics, environment, hormones. It's this whole tangled web.
Absolutely. It's far, far beyond that old idea of it just being about willpower. That's just not the whole picture.
Not at all.
And because it is complex and chronic, well, we need tools that reflect that.
Yeah.
What the research keeps showing is how much impact even relatively small changes can have.
Right, like losing just 5 or 10% of your body weight.
Exactly, 5 to 10%. And you see these dramatic health improvements. Type 2 diabetes going into remission sometimes, lower blood pressure, people moving better. It's significant.
But, okay, what about when the usual advice, diet, exercise, the foundation just isn't enough? When those, hormonal factors or genetic predispositions are really strong?
That's the challenge, isn't it? Finding that bridge between lifestyle changes and more invasive options like bariatric surgery.
And that bridge is exactly what we're diving into today. We're looking at the Allurion swallowable gastric balloon program.
Right. So our plan is to really unpack this. What is this technology? How does it actually work? I mean, a balloon you swallow like a pill.
Seems wild.
It does. And we need to look at the clinical side. Who is this actually for? What's the BMI range, the criteria? It's quite specific, between 27 and 40 kilobarometer weighs.
Okay.
And crucially, the support system. Because the goal isn't just the 10–15% weight loss people often see. It's making that sustainable after the balloon is gone.
And this is where I think it gets really interesting, because it feels like the tech is almost, well, it's enabling a behavioral shift.
That's a great way to put it.
I mean, a weight loss device you swallow, check with an x-ray, no operating room. It's a physical intervention, yes, but maybe its biggest role is creating that window, that kind of reset for 16 weeks.
It's definitely a breakthrough, largely because it avoids surgery and endoscopy. This Allurion Gastric Balloon, it's the first one designed to be swallowed and passed naturally.
Developed in the U.S., right, by Dr. Shantanagar.
That's right, a Harvard-trained physician and developed by Allurion Technologies. The non-invasive part is key.
Okay, let's get into the mechanics. How does this balloon actually get into your stomach if there's no procedure, no endoscopy?
It sounds complex, but the process itself is actually pretty streamlined. That's part of its appeal for patients. Step 1. The patient swallows a capsule. It's about the size of a large vitamin pill.
Okay.
And this capsule is attached to a very thin, flexible tube, a catheter, that stays outside the mouth initially.
Right, so you swallow the capsule, tube attached. Then what? You need to know it's in the right spot, surely.
Absolutely critical. Safety first. So step 2.
Yeah.
They immediately confirm its position in the stomach using a quick x-ray, sometimes ultrasound.
Got it.
Once the medical team sees, yes, it's perfectly positioned, then they move to step 3, inflation.
And how does that happen? Through the tube.
Exactly. They use that thin catheter to fill the balloon inside the stomach with about 550 milliliters of sterile fluid.
Wow, 550 milliliters. That's like a can and a half of soda, volume-wise.
It's a substantial volume, about the size of a small orange or a grapefruit, maybe.
Yeah.
And that is the core function.
The physical governor, you called it earlier.
Precisely. It physically takes up space in the stomach. So what does that do? It helps you feel full much sooner when you eat and stay feeling full for longer afterwards. It helps quiet that sort of metabolic noise driving hunger.
So it naturally encourages smaller portions, less calorie intake, without that constant battle of feeling deprived.
That's the idea. It provides a temporary physical assist, which can also give a bit of a mental break from constant hunger cues.
Okay, that makes sense. But the next logical question is removal. If it goes in without endoscopy, how does it come out?
And that's the other really clever part of the design. No removal endoscopy is needed either.
Really?
Yes. The balloon is engineered to stay in place for a specific duration, about 16 weeks, 4 months.
Okay.
That time frame isn't random. It's designed to be long enough to help establish and practice those new, healthier eating habits and routines.
And after 16 weeks?
After the 16 weeks, a special time-controlled release valve within the balloon automatically opens. The fluid empties out. The balloon deflates back into a small, soft membrane.
And it just passes naturally.
Exactly. It passes naturally through the digestive system like any other waste. So the huge advantage is clear. No anesthesia, no endoscopy for placement or removal, no hospital stay needed. It's an outpatient procedure.
That convenience factor is massive, but it's still a medical device doing significant work inside the body. Let's talk about the people. Who is this actually designed for? Who's the ideal candidate?
Yeah, patient selection is absolutely key. This isn't for everyone. It's targeted at adults 18 years or older
All right.
who fall into a specific BMI category,
Yeah.
body mass index between 27 and 40. So that covers overweight and class 3 obesity ranges.
And typically people who've tried other things first?
Yes, generally it's for individuals who've genuinely struggled to lose weight and keep it off with diet and exercise alone. But importantly, they're either not ready for or maybe not eligible for the more invasive surgical options.
So it really slots into that space between lifestyle efforts and full-on surgery. Interesting point, though. Does the easier placement, the non-invasiveness, ever lead to maybe less psychological commitment compared to surgery?
That's a really insightful question,
Mm.
and it points directly to why the program structure, the coaching, is so intense and mandatory.
Ah, okay.
The sources suggest the rapid initial weight loss actually boosts motivation significantly.
Right.
But you're right, there's a potential pitfall. That's why the aftercare program is rigorous. It's designed to build that commitment while the physical assist of the balloon is there. Maximize that 16-week window.
Makes sense. So let's talk about the safety net then, the
Yeah.
medical checks, the contraindications. What absolutely rules someone out?
Safety is paramount, obviously. You're putting a device filled with over half a liter of fluid into the stomach. So the basic GI system needs to be healthy,
Meaning?
meaning anyone who's had major stomach surgery before, like previous bariatric surgery or significant bowel resections, is usually excluded. Also, a large hiatal hernia is a no-go.
Why the hiatal hernia specifically? Is it the risk of displacement or irritation?
Exactly. A large hernia means part of the stomach is displaced upwards. Putting the balloon's volume and pressure in there could cause significant pain or complications, especially since placement doesn't involve direct visual inspection, like endoscopy.
Okay, what else?
Active stomach ulcers, severe gastritis, any active bleeding disorders, those are contraindications. The balloon could aggravate those conditions.
Any medications or life stages?
Yes. Pregnancy or planning pregnancy soon rules it out. Severe active eating disorders or significant swallowing difficulties are also exclusions. And crucially, chronic use of certain medications like strong anti-inflammatories, NSAIDs, or blood thinners, anticoagulants, is generally a contraindication due to increased risk of GI irritation or bleeding.
Got it. Very thorough screening needed. So, assuming someone is a good candidate, they follow the program, what are the typical results and what's the initial adjustment period like?
The results reported are generally quite positive. Most patients tend to lose between 10 to 15% of their total body weight during those 16 weeks the balloon is in place.
10 to 15% in 4 months is significant.
It is. But it's really important to stress this isn't just the balloon working in isolation. It's the balloon plus the structured diet plan plus the behavioral coaching. It's the whole package delivering that result.
Right, the integrated system. But let's be real. Having something inflated inside your stomach, day one, probably isn't pleasant.
No, there's definitely an adjustment period. The sources are clear that side effects are common, especially initially. But they are mostly mild and temporary.
Like what?
Primarily in the first, say, 3 to 5 days, nausea is quite common. Some people experience vomiting or stomach cramps as the stomach adapts to having less space.
Sounds tough, but hopefully short-lived.
Generally, yes. And the medical team anticipates this. They prescribe anti-nausea medications, sometimes acid reducers too. Other things like bloating, maybe some acid reflux, constipation, even bad breath can occur. But these are usually manageable with medication, staying well hydrated, and light activity like walking.
Okay. And what about serious, though rare, problems? You have to mention those.
Absolutely. Transparency is vital. Rare risks do exist. One is a balloon intolerance where the side effects just don't settle, and it needs to be removed early. Though removal is still usually straightforward.
Still no major surgery needed for that.
Correct. There's also a small risk the balloon could deflate earlier than the planned 16 weeks. And extremely rarely, as the deflated balloon passes through the intestines, it could potentially cause a bowel obstruction.
Which is why ongoing medical contact is important.
Crucial. Patients are monitored throughout the 16 weeks and for a period afterwards precisely to catch any issues early.
Okay, that monitoring leads us perfectly into what you said is critical, the aftercare. The balloon is gone after 16 weeks. Obesity is chronic. How do you make the results stick?
This is where it shifts from just a device to a full behavioral program. The balloon provides that initial motivating weight loss. The program then uses that momentum to try and lock in permanent changes.
How? What does that support look like?
It's comprehensive. You usually have a whole team, nurses, a dietitian, regular check-ins with the doctor. It's very structured.
Walk me through the first week after placement. That sounds like the most intense phase.
It is. That first week is very regimented. It's strictly liquids, then moving to soft foods, following a specific plan. This lets the stomach adjust comfortably. And taking the prescribed anti-nausea and acid control meds is non-negotiable during this phase as part of the recovery protocol.
And then, after that initial liquid soft phase.
Then the focus shifts to reintroducing balanced, solid meals, but with very clear guidance. Think high protein, lots of vegetables, good fiber, and the key behavioral rules kick in hard here. Eating slowly, chewing thoroughly, stopping the moment you feel comfortably full, which the balloon makes easier to recognize.
Learning those satiety signals again?
Exactly. And avoiding things like carbonated drinks, which can cause discomfort, and obviously very large meals.
It really sounds like you're retraining your whole approach to eating.
That's precisely the goal, and it's reinforced daily. Patients are typically required to drink plenty of water, at least 1.5 to 2 liters a day, and get about 30 minutes of light exercise, like walking.
Is there tech involved too? Tracking?
Yes, usually. The program often includes the Allurion app and a connected smart scale. Patients track their weight, their food intake, their activity. It builds accountability.
So the balloon forces the physical change, and the program forces the behavioral tracking and learning.
It creates this environment where compliance with the lifestyle changes is easier, or at least more supported, during that crucial 16-week period.
And does the support just stop when the balloon passes?
No, absolutely not. That's key for long-term success. The maintenance phase involves continuing with the nutrition plan, maybe modified, and having periodic reviews with the team for months afterward. That follow-up is designed specifically to help prevent weight regain.
Okay, let's recap the big picture then. What makes this Allurion program stand out?
I think the key differentiators are no surgery, no anesthesia, no endoscopy required, ever. You get clinically demonstrated weight loss, that 10–15% average, within a defined 16-week time frame. And it's all built around this CE-marked, medically supervised device and program.
And connecting it back to managing a chronic condition.
Well, the whole structure is really designed to make habit change possible. The balloon gives you 16 weeks of physical help feeling fuller, managing hunger cues, which frees up mental energy. Energy you can then focus entirely on learning and embedding those long-term eating and lifestyle strategies.
So reflecting on all this, the device is temporary, only 16 weeks. But the program, the tracking, the diet plan, that's aiming for permanence. Which leads to, I think, a really interesting final thought for you, the listener, to consider. If this program is successful for someone, does it suggest that maybe the balloon itself isn't the solution, but rather a powerful temporary catalyst? A tool that creates the necessary physical window, that reset, allowing the intensive behavioral coaching and lifestyle changes to finally take root and potentially last a lifetime. Makes you think about the role of temporary interventions in creating permanent change, doesn't it?